In a major change aimed at tightening the rulings of cough medicines, the Union Health Ministry has amended the rules to remove quote-unquote syrups for cough from Schedule K, the list of medicines that can be sold without a prescription from a registered medical practitioner. This means that consumers will no longer be able to buy cough syrups directly from pharmacies without a doctor's prescription. However, lozenges, pills and tablets used for cough treatment will continue to remain exempt under Schedule K. The centre had released draft guidelines on the proposal in December last year and invited comments from stakeholders before finalizing the amendment. Now, this move comes months after at least 22 children died in Madhya Pradesh's Chhindwara district after consuming contaminated cough syrups. Around the same time, there were also reports of children dying in Rajasthan after consuming cough syrups that were not meant for young children in the first place. Under the new rules, all cough syrups, including those containing addictive opioid-based ingredients like codeine, will require a doctor's prescription before they can be sold. The issue was discussed by the Drug Consultative Committee, a panel of experts under the apex drug regulator, in November last year, following the deaths in Madhya Pradesh. The committee examined whether ingredients other than propylene glycol could be used in syrup manufacturing. Propylene glycol is believed to be the source of contamination involving toxic substances such as ethylene glycol and diethylene glycol. Health experts have also pointed out that prescription-only sales could help prevent children from consuming formulations like dextromethorphan, which are not recommended for children below the age of 4 or 6 years and can cause severe respiratory depression and even death. In 2022, the World Health Organization issued an alert after reports emerged of 70 children dying in Gambia and another 18 children dying in Uzbekistan after consuming syrups manufactured by companies based in Haryana and Uttar Pradesh in Tamil Nadu. Now, following those incidents, the government made it mandatory for all syrup batches meant for export to undergo testing at central or state drug testing laboratories. However, that measure did not address contamination in syrups sold within India, as highlighted by the Madhya Pradesh case. India has witnessed similar tragedies in the past as well. In 2020, at least 17 children died in Jammu and Kashmir's Ramnagar after consuming a cough syrup manufactured by a Himachal Pradesh-based company. The syrup was later found to contain nearly 35% of DEG. Earlier in 1998, 33 children died in Gurugram after consuming a syrup manufactured by a local company. The product was later found to contain 17.5% DEG. Around 150 children suffering from acute kidney failure were subsequently brought to Delhi's Kalavati Saran Children's Hospital, triggering widespread concern and renewed scrutiny of syrup safety standards. The latest decision by the Health Ministry is being seen as an effort to strengthen safeguards around cough syrup sales and prevent further incidents linked to contamination and misuse as well.
गवर्नमेंट ने 9 जून को एक नोटिफिकेशन गैजेट द्वारा डिक्लेयर किया है कि कफ सिरप, नॉट ओनली सिरप, कफ सिरप भी विदाउट क्वालिफाइड डॉक्टर के प्रिस्क्रिप्शन नहीं मिलेगा। तो हमारी गवर्नमेंट के निर्णय हम उनका स्वागत करते हैं कि एक अच्छा निर्णय है, क्योंकि मोस्ट ऑफ द सिरप में थोड़ा कैफीन वगैरह आता है, तो लोग नशे के लिए बहुत यूज करते थे और हम कोई भी टॉयलेट में जाओ दो तीन सिरप की बोतलें भी मिल रही थी। और दूसरे छोटे बच्चे जो 3 साल से छोटे बच्चे हैं, उसको कफ सिरप बिना डॉक्टर की परमिशन देते कभी कभी बच्चे मर भी जाते हैं। तो ये सब देखते हुए गवर्नमेंट ने जो पॉलिसी ली है, डिक्लेयर किया, तो हम उनका स्वागत करते हैं, हम उनको सपोर्ट करते हैं।
Now we have Professor Dr. Sanjeev Bagai, Padma Shri, Chairman, Nephron Clinics and founder, Zenray Thank you so much for taking time out to be with us over here, Professor Dr. Sanjeev Bagai. This is about time that we find ways to clamp down on the sale and purchase of contaminated and syrups that are not even meant for certain age groups. It is a tragedy that we were able to contain the exports, but not the sale of it within the country.
Good evening. I think this is a strong move. It's a move in the correct direction. By and large, if you see in children, even up to the age group of 10 or up to 15 years of age, one amongst the commonest used medicines, and indeed, if I may add, I dare say overused, misused, and misprescribed formulation are cough syrups. So for the general public, I must explain cough syrups can be of various ingredients, various types. It can be something which is an anti-allergic. It can be an antitussive, that means cough suppressant. It can be a mucolytic, that means it's to dissolve the mucus to make it thinner, or indeed it can be in combinations. Now here lies the problem. Very often a cough syrup is considered as one size fits all, which is completely wrong. The doses can go amiss. In children, it's milligram per kilogram per day dose calculation, and especially the general practitioners or indeed even the non-qualified people who we call as the quacks are using these left, right, and center. Most of these medicines contain ingredients which are neurotoxic and respiratory depressants. That means a child can acutely have respiratory distress and can die because of respiratory failure, or can have seizures because of neurostimulation. That means stimulation to the brain. The other chapter is in case there are contamination. Now, the commonest contamination which we have seen in this part of the world is something which we call as DEG, which is diethyl glycol. This is a complete toxin. It's a nephrotoxic. It's a carcinogen. Within 2 to 4 hours, especially the smaller children and infants who are as it is sick, can manifest with acute intoxication, nausea, vomiting. Within 12 hours, you can have acidosis in the blood. You can have surges of BP going up, and what we call as stage 3, within 24 to 72 hours, you can have acute kidney shutdown, and oxalate crystals come onto the kidney, which are metabolized by the kidney to form crystals in your urine, and the kidney shut down. So I think this is a very, very strong move. I would go a step further and say most of the medications must have a valid prescription, which is validated according to the date. Therefore, repeat prescriptions of few months back cannot be and should not be duplicated and re-given as sales of medication. All pharmacies and chemists and dispensing outlets must maintain records. Every receipt must be computerized. You cannot have handwritten purchase, handwritten records, which ultimately do not form your database. Prescriptions must be from a qualified doctor, and a record of the doctor's name should be maintained. That should be mandatory in pharmacies. Otherwise, we will not know which batch number, which lot number, what was the date of expiry, which was the formulation in the medicines which were prescribed. Combination medicines is a huge error. Combination means sometimes a bronchodilatic. That means something for wheezing is combined with an anti-allergic with a cough syrup. It's a complete nonsense. This is fraught with danger. These kind of combination medicines in a sick child where the kidney function as it is may be compromised, liver function may be compromised, you can slip the child into respiratory distress very quickly. So I welcome this move, and I would wish that this implementation as a law becomes really stringent.
Implementation is going to be key, isn't it, Professor Dr. Sanjeev Bagai? And that is what the questions are over it. How do you ensure that such a broad, sweeping amendment to the law like this gets implemented right? First, it has to be from the till the last mile, isn't it? Till the pharmacy, from the pharmacy till the doctor.
So it's a multi-pronged attack at multiple levels. So let me quickly explain how we can go about it. I think public awareness and driving home this public information, which is correct in science, is very important, and media has a huge role to play. It is so massive that you cannot imagine. It should not be a one-off kind of messaging. It should be a campaign that safe medication prescribed by a qualified doctor is a better way to go around it. Very often, the chemists themselves give the medicines without a doctor's prescription whatsoever. Second thing is the patient's responsibility. Patients should not go to the chemist and make a chemist a doctor and take any medicines trying to cut corners so that they don't visit a doctor. it is very, very, very dangerous. Third is that the information should be given with regards overall functioning as far as the medical community is concerned, that children should be seen by qualified pediatricians. The doses must be accurately calculated. In case there is any adverse effect, it can happen with any medication. There should be a systemic way in which these side effects are reported so that there is a record maintained so that we can track that batch number, that lot number to make an early investigation more authentic. So I think it's public information at the patient level, at the doctor level, and the pharmacy level. But strict maintaining of the records must be maintained, must be made mandatory. Like I said, handwritten receipts, invoices, which have no trail at all. You don't know from where the medicines have come. You don't even have a record legally to prove that the medicines have been sold by them. And these cash dealings in and out is a big no-no. Last I would like to add is these online sales very often can become very dangerous. Online sales, there are multiple platforms, I'm not taking names, which are giving online sales of medicines. Within half an hour it will reach you without a prescription. This is again extremely dangerous.